Thanks for joining us on this episode of the Pulse Podcast, brought to you by Rocky Mountain University of Health Professions. Today's guest is Dr. Mary Shotwell, a faculty member who wears multiple hats at RMU. Dr. Shotwell received her bachelor's in occupational therapy from Temple University, her master's in health professions education from Medical University. Mary earned certificates in gerontology and qualitative research from the University of Georgia. She's worked in many areas of occupational therapy, and she's worked at 3 different universities as a faculty member and in leadership roles, and we're excited that she now works at Rocky Mountain University. She's also been in state and national occupational therapy associations, authored numerous book chapters and peer-reviewed journal articles, and she is a professor and works in the research here at Rocky Mountain. Welcome, Mary.
Thank you. Great to be with you.
Yeah, we're excited today, and this is an interesting topic. I know it hits close to home to a lot of us, and I'm excited to dig into it. We're talking about aging in place, and we're thrilled to have an expert here. So first of all, can you define what that is, aging in place, and why it's so important?
Well, I think some people think that aging in place merely relates to old people, and it doesn't. So, yes, it relates to old people in that all of us want, if at all possible, to stay in our own home as we age, right? And in fact, only 5% of older adults live in nursing homes, even though, I think our perception gets skewed. So most of us will live in our home until we die. So that's what we all hope for. But there's a whole nother segment of the population that maybe has a disability, if you will, that maybe are a little younger. And as they age with a disability, their needs change as well. And their home or facets of their life may need to be reconfigured. And that's where occupational, physical, speech pathologists, nurses come in handy to help people problem solve this dilemma.
Yeah, that's interesting. Yeah, because you do think of it being mostly elderly people, and my kids are starting to joke about, when we put you in the old folks home, and
right.
It's a topic that a lot of people think about, but that's an interesting way to look at it. So I didn't realize that only 5% of adults live in nursing homes. So fascinating.
Right, yeah.
What are some of the big areas of concern for aging in place and the disciplines that might be involved?
And so I think when people think about aging in place, they think of the home, they think of ramps, they think of grab bars, they think of bathroom safety, and those are all important. But what about driving? One of my jobs as an occupational therapist in a prior career time frame was evaluating people for safety in driving. And I'm still somewhat active in the Association of Driver Rehabilitation Specialists, and they have a discussion board. And recently, the discussion board was, I have an evaluation coming up for a 100-year-old lady. So, you and I might laugh and say, well, are you crazy? She shouldn't be driving. And I don't know, right? I don't know if she's safe. And so that's something people need to plan for transportation. What do I do if I can't drive anymore? If I live out in the country, it's a problem if there's no public transit. So those are things that we need to plan for. And also for caregiving. So, you may be aware of something called long-term care insurance, right?
Sure.
Well, long-term care insurance is great. It can cover some in-home care. It can cover, if I maybe have dementia, it might cover somebody to come and sit with me during the day.
I'm curious, how would you suggest that somebody brings up a conversation like that? Because you don't want to make your parent or the person
right.
that you're with think that you're trying to push them away from you. But you want to
Right.
be sensitive about it. What are your suggestions
Yeah,
there?
yeah. Well, obviously, there are people, you could use a counselor to help with the conversation, or it's, a family meeting, or, you write your wishes down, what it is you want. So, we have a living will, we have advanced directives. So, why don't we have an aging in place plan? To me, it's about transparency and communication, or at least writing it down and telling someone, hey, in the safe deposit box or in the safe are instructions, are, is information about finances. So I think those things are really should be an important part of aging in place planning.
Who would be some of those certifying bodies that provide credentialing for aging and
Okay, great question. So,
in place
of course,
specialists?
I'll give my profession the first plug because as an occupational therapist, our goal is to help people do the things they want or that they need to do. And one of our key ways of doing it is we look at the person and their capabilities. We look at the environment and what barriers or affordances are in the environment. And then we look at the things people want or need to do. Physical therapists clearly would help with mobility, keeping up one's strength, one's endurance to do the things they want or need to do. Speech language pathology, communication, many older adults may have swallowing challenges and they might help with that because if I have swallowing problems, something as simple as that, and I live on my own, they might say, you're not safe to be at home on your own. You need to go into a nursing home. Well, maybe not.
In your work as an occupational therapist and a gerontology professional, can you share some stories where principles of aging in place might provide good examples of what you might be able to do?
Yes, yes. So a couple things that I've done, and this could be with like just well people, not people with the disabilities. So I had a colleague at one of my former universities, and she was building her dream retirement home, and she wanted flexible space. And if you think about it, particularly me, I'm a short person, and more counters and cabinets in people's homes are built for the average height person, which is between 5'5" and 5'11". Well, that doesn't work for me, right? Like the sink is in the middle of my chest because I'm short. So why, if I was had the luxury of building my dream home, why could we not make the counters a little lower? It's about devices, objects, spaces that are not just accessible for people maybe who have a mobility impairment, but maybe also an endurance impairment, maybe also different height, maybe a cognitive impairment. And so it's really looking at environments and trying to apply these universal design principles. The other thing that I think about a lot is people with mild dementia. And people with mild dementia in a good home environment, like almost like a smart home, um, might be able to stay there a little bit longer. It doesn't mean maybe they won't end up somewhere else, but even if it buys them a couple more years at home, then that might be worth it.
How important is it to have those family members involved, and
Oh, it's
what are your suggestions on how they can?
critical. And
Yeah,
to me, this is where a counselor or a social worker could come in handy, maybe to help with the family meeting. Okay, your two sisters are going to be the primary people, but what are we going to do for respite for your two sisters?
Right.
Because this is going to wear them down and this is going to challenge their health if we don't, and they probably have their own families, or, even if they don't have their own children or spouse, they have their own lives, right? So, how do we support the people who are supporting the people aging in place? And that is where we, navigate this or make a plan. Okay, you're going to get an every other weekend break that you would come over and give your sisters a break, you know. But that, in mature families, they work this out on their own. But, many families, you got like dynamics, right? You got family drama before all this mess. And then you add this onto it. And sometimes people step up to the plate and everybody pulls together. And then other times it, it, makes the drama even worse, and that's when you need an outsider to help. So, and I really feel like social workers and family therapists are really good people to help navigate that. Geriatric care managers also help a lot with this.
Oh yeah, no, that's great advice. There are just so many different factors, because safety being the first issue. Like my mom,
Right.
she had fallen, but we thought we had set up the house to be safe for her. But it sometimes you can't safety proof everything, and so
Right,
those
right. And
accidents are going to happen. And you're not. My sisters weren't trained. Bless their hearts, they did as much as they possibly can or they could, but some people just aren't trained for dealing with
correct, correct.
dementia and elderly
And there is
people.
this concept in many disability realms called the dignity of risk, right? We are willing to take the risk for now that mom may fall, and what we're going to do is do our best to protect her. And so it's maybe a silly example, but there's actually these things called hip helpers. And they're
Mm.
actually pants with sort of built in cushions near the hips so that if they do fall, it cushions the fall. Or a lot of people say, take up all your flooring, right? Take up all throw rugs because people might trip over the throw rugs, for example. But then maybe they spill something on the floor and nothing absorbs that water and then they slip on the water. So, my point is every solution breeds a new problem, right?
Right.
And you have to kind of weigh the risk versus the benefit of each decision. And that's where, if I was working with a family or an older individual or an individual with a disability, I might um, say, well, this is the potential benefit of this device or this adaptation or this strategy, but here's the potential threat. And let's weigh out, and to the degree possible, give the older adult, give the person with the disability agency in making some of these decisions. Don't put it all on the adult children either.
Along those lines, what are some practical tips you would give to someone or a family for starting to plan for aging in place?
Oh, okay. So, what I love is AARP.
Mm.
AARP has all these amazing worksheets, and it has like a long-term planning worksheet, but it also has like worksheets about contractors, worksheets about resources in my community, worksheets about adaptive equipment that I might need going forward. Every major kind of metro area in the country has these assistive technology resource centers, and they will have equipment that they can loan somebody. Every state in United States has an area agency on aging, and they may call it something different, but basically those are people that can help you problem solve through some of these challenges. They could also connect you to resources.
What is RMU doing? What kind of resources and programs do we have?
Yeah, I like the RMU question because our clinics are incredibly helpful at doing some of these things. The really cool thing is that through interaction with students and students talking with their faculty, they could say, oh, this client that came in the clinic, they really are talking about being lonely. What resources might we be able to connect them with in our community? And so every clinic, the OT, the PT, the SLP, the psychology clinic, the PA program, even the nurse practitioner programs, when they come on campus, there are interactions with clients that they may then assess them for aging in place and connect them to resources.
Why are you so passionate about aging in place?
Because I'm old. I'm getting there, and I want to make sure I'm taken care of, right? I mean, and I'm not afraid to talk about it, and I think no one else should be afraid to talk about it. We should be transparent with those around us, and again, even if it buys us 6 months of being in our home, that's 6 months I saved of money being in a nursing home and 6 months of dignity where I'm in my own space.
Any last tips you'd like to give on aging in place for helping extend that time at home?
I would say reach out for help, and there are a ton of resources on the internet, thank goodness.
All right, we'll
And
put those in
talk
the show
to
notes.
your family.
Yes. Well, Mary, thank you so much. We appreciate your expertise, and we've now reached what we call the rapid fire round of the Pulse podcast. So I'm going to ask you some quick questions. You just fire out some quick answers.
Okay.
All right. If you could switch careers, what would you do?
Oh, I would be a light designer for car vehicles because I'm obsessed with the way nowadays the light designs on cars are so cool. Or I would be a person who names nail polishes or lipstick
I love it.
because it's a creative enterprise.
What's the best piece of advice you've ever received?
The best piece of advice is not to take yourself too seriously.
If you could have a superpower, what would it be?
I would definitely fly.
What's a skill you'd like to master?
I would like to be able to speak Spanish. Yeah.
And last question, what word would you use to describe yourself?
A little wacky. In a good way, wacky.
Well, I know you are beloved here at RMU and you're delightful.
Well, thank
so those are a couple words I'm going to use. Thank you so much for generously offering your time and expertise and all these great tips on aging in place. We will have a lot of those resources in the show notes, and we're grateful for those who have joined us for this podcast. Please tune in for the next one.
Thank you. Have a great rest of your day. Bye-bye.